Should private hospitals treat coronavirus patients or not? The Nigerian government seems to contradict itself. And comments made over the death of Abba Kyari causes one to lose his job. This is Plus Politics, and I am Felicity Ezewike. You're welcome to the program. The Health Minister, Osage Hanire, stated recently that the Federal Ministry of Health has not accredited any private hospital to treat COVID-19 patients. However, now the Lagos State government also advised private hospitals not to treat coronavirus patients and said it's accredited the hospital where Abba Kyari, the Chief of Staff to President Muhammadu Buhari, died on Friday. Joining us to talk about this is a legal practitioner, Raymond Nkanebe. Thank you very much for joining us.
Thank you, Felicity, and good evening, Nigerians.
Good evening.
Yes.
And via Skype, we're joined by Chima Onoka, a medical practitioner. A pleasure to have your company on the program.
Thank you very much.
All right, let's start with you. There is a controversy at the moment. Just a day before we heard that Abba Kyari has passed, the Minister of Health said there was no private organization accredited to manage COVID-19 cases in the country. And that's just coming days. The state government here in Lagos State said a hospital has been accredited, and that's where Abba Kyari was. What do you make of all of this? Can you hear me?
All right. So I should go ahead.
Yes.
So the issue we have really is a daunting one, and I think we need to remember that Nigerians are over 200 million, and with what we have on our hands, the pandemic, it means that at this point we need to activate every system that we have. The public facilities are not sufficient to manage 200 million people who are exposed in one way or the other. It means that the conversation is not really supposed to be about whether private facilities should or shouldn't. It's about activating every facility that we have in the country to make it capable of doing it. That's what the conversation should really be about, that they need to be activated. And not whether or not they should be involved. So the earlier we move to that conversation, the better for Nigeria.
But there's a worrying concern among people that the secrecy around this amplified the conversation about it right now. And of course, the antecedents, the comments that I've made before. The government, on the one hand, says that they have not accredited a hospital. And then on the other hand, they're saying that they have now. And that is just coming after Abba Kyari died. What stopped them from announcing this before we had the case of Abba Kyari having a private treatment?
So yes, granted, we have, it's a public health problem and information should be out there. But you will agree with me as well that so many Nigerians are still keeping the information about even their own exposures to themselves. And then governments are also trying to be defensive. And it's not just about what's happened, with the federal government or the Lagos state government. So in a situation like that, I really think that we need to leave a lot of the noise to push as citizens and everybody in this space to push for the right things to do. So to be done. Now that information wasn't there, but we should quickly move from that point to insist on the right things. And to start making people know, even, in terms of that, this is not a time for such secrecy. This looks like a mistake. Getting government to admit there is a mistake or not is one issue. But sticking to that point when time is of essence in the responses, will be a bigger problem for us to get engaged in. So it's like we need to move forward. This is not the right way to do it. It's elicited a lot of public response. And we should quickly move on to get government to insist that government does what is right in terms of information.
All right. Let's bring you in, Raymond. You've heard his submission, but I want to ask you another angle to this conversation, that the announcement by the Lagos state government was a damage control mechanism. Do you agree that is the case? And going forward, what should be the practice?
Well, thank you very much. I think you phrased the question in the right manner, being that the Lagos state government statement came immediately after Abba Kyari's misfortune. And then when you weigh that statement against what the Minister of Health said as early as 24th or 20th, sometime in March, cautioning private hospitals not to undertake treatment of COVID-19 patients. And then you may want to see a sense of an afterthought trying to correct that very negative impression, because immediately after people found out when the presidency communicated that this man has died, I know before then it was a public knowledge that he has been admitted to a private center in hospital in Lagos. So Nigerians became worried. But we were told that this, you understand. So that gives the sense of trying to correct a damage control sort of. But that is even collateral, as the doctor has observed over there. Then, in terms of what should be the way forward, I want to disagree with the doctor with respect. He says that we're over 200 million. Of course, we know we are over 200 million, but so far, by the special grace of God, our numbers are not up there yet. And we've heard from different state governments, and from what we've seen in the media, they seem to be ramping up their facilities to meet this situation in the event we have an exponential spread. So I don't think we've gotten to that point whereby we're left with no option but to activate our private hospitals, particularly when we are dealing with a very delicate virus with a very strange behavior. You understand? How many of these private hospitals have trained infection disease specialists? The support staff who are going to handle nurses and all of that, they don't have the capacity. So if we're going to get to the extent of involving our private hospitals, we have to do it with some bit of caution to make sure that any hospital that have to be accredited to take care of these issues will have all it takes to handle. So we don't have a case whereby we now have a widespread of the case. So it must be guided by policy and some sense of orderliness. Not every hospital taking up patients as if you are treating headache or malaria.
Okay, Dr. Chima, the Lagos State chapter of the NMA earlier issued a statement that there is a worry that they have that involving private hospitals might losing the link to community transmission that we have. And that's what they're saying, that if the government allows that to happen, the little break we have now, the less community transmission we have now, might escalate much more than we can handle. What is your take on that? Why do you think that advice was ignored?
You see, thanks to the colleague on the station too, it's a certain, where we are is such that, you know, we can get and we can hear about figures, but remember that they took days to get those figures that were released yesterday to us. And those days, transmission is going on. So when you have somebody who has been confirmed positive, that's after several days. And remember that for a lot of reasons, our testing capacity hasn't expanded. And I know the NCDC is working very, very hard to see that happens. But to plan based on the numbers of yesterday is actually planning for disaster. And so that's why those figures are not the best to use for planning. The figures are a reflection of the past. And so linked to the question that we're talking about, people who are sick are going to look for where to get care. And they already their way with some cough, with something, going to a facility, whether it's public or private, they will go. Remember that when they go there, the health worker has to find a way to decide whether this is, what is it that is going on. And then there are lots of risks that are attached to that. So whether we like it or not, they are going to meet, and they are meeting doctors. Remember, someone died, just died, and it was because of, somebody coming to the private hospital, and people are going to come. Nobody wears COVID-19 on his face when he's going to seek care.
But what about the concern you've still not addressed the concern that I raised, that the NMA, your association, said that it might be the link that will expand community transmission, because these private hospitals might not have the capacity to do what they say. This is an unknown virus, mind you.
Yes. So that's the issue. There are private hospitals, and those private hospitals a lot of them are places where people are used to. That's why I said at the beginning that the conversation should not be, the conversation should not be whether or not they engage in it, but how quickly we get them to be able to do what they should. And that is, there are standards for treatment, because the facilities that we're talking about can't even triage, can't handle the numbers that we're even talking about, because community transmission is going on already. So you need the centers where people can be taken care of. We know the numbers of beds that we have there. There are places where people will get taken care of. But then the people who are first coming to seek care, people who look for where to get health care, are first of all not labeled as COVID-19 infected. There are people who are coming with normal symptoms, and people are transmitting. Somebody needs to be able to triage them. And that is where everybody comes in, really. Somebody needs to say at the beginning, is this likely to be a case of COVID-19 infection or normal issues? And those people who, it can be any one of us, can approach. People are going to the health facilities for several things a day. There are levels of care at every time. There are levels of care. With the population you have, people are going, even without knowing that they have symptoms, they are approaching their health facilities for other kinds of healthcare needs.
All right,
so
Doctor,
that's why everybody has a role. Everybody has a role. It's role definition that needs to be put in place for the level of care that is needed, not a yes or no thing, but role definition. That's what is important.
All right, I didn't want to just interrupt you so you can land with your thoughts. Let me come back to you, Raymond, because the essence of conversation like this is to explore all range of thoughts so we can, know what we're doing. The NMA in that statement that was issued, I want to quote something that they said. The state government may have started yielding to pressure from business concerns who might see this pandemic as a business opportunity rather than the public health emergency that it is, end of quote. Do you think that there is anybody now that will be looking at this pandemic as a source of income as it is, other than the desire to help, like the doctor is saying, alleviate the concerns of the people and cure as many people as possible?
Yeah, thank you very much. I was going to get there. You see, we cannot, I don't want to, with all due respect to the medical practitioners, private hospitals are also businesses. As much as they render healthcare services, they are also businesses. And the core motive behind any business is to make some money. You understand? Now, I understand, I imagine some of these hospitals are positioning themselves to attract some high-profile patients who they intend to coup some money from, right? So that's why, even if the private hospital should be involved, the ultimate motive should not be to reap profit. And that's why, if you look at what happened in Ireland and even in England, when their cases started rising, they had to enter into an understanding with the private hospitals. But then it was on the basis of they are going to be paid only for the cost of services they render, not any profit that they ought to have made from rendering such services. You understand? So I understand the sentiment of NMA trying to make sure that this should not be an opening for private hospitals to make a windfall. You understand? So to that extent, I agree with what NMA is saying. If at all we get to the stage where we involve our private hospitals, the ultimate motive should not be for them to make money. And as the medical doctor began to say, I agree that given the nature of this virus, where the symptoms is, it has almost the same symptoms with every other sickness until you get to the critical symptom like chronic coughing, right? I agree that private hospitals can have holding centers whereby they monitor a particular your symptoms and get in contact with NCDC officials. I say, okay, we have this patient. We think is a case of COVID-19. We don't think we can handle him. We should send him to you. So there should be that synergy between private hospitals and NCDC. They should not set out to go into treatment. They should monitor the situation in a holding facility. And of course, they should have their clinical procedures to detect some of these things. And if it's a case where there's a high suspicion of COVID, they should always get across to NCDC to take up with that. They should not go into treatment.
Okay, still talking about this, just to take a lift from what you said, Dr. Chima, there is yet to be like a codified protocol for the treatment or containment of the virus. Am I right on this? Is there a national document already? Have we walked up to that stage where we know that this is how to treat a COVID-19 or contain a COVID-19 patient that can be adopted by these private organizations to help in the care of these patients?
Yes, there is. And both Dr. Chikwe in NCDC and then the Minister of Health spoke about it, when it was released. It was published, it was made available. Okay. What is left or what is going on is the translation of that to actual practice. So bringing it down, decentralizing it to the units of care for people to know what to do. And that usually will start, of course, as usual, with those centers of care, the big centers of care, the teaching hospitals, and then the centers that are being set up in different places as, points of care. So that document is there. It's now operationalizing it, that is ongoing. That's usually a slower process, but there's been a lot of training that is ongoing. Different people, individuals, organizations have been trying to use that. I mean, I know, and it was, presented. I know NCDC also asked everybody, the Nigerian Medical Association, the Medical and Dental Consultants, the Christian Medical and Dental Association of Nigeria, look at the materials that we have, make use of it, try to help everybody to come up with an understanding of this protocol. That's been going on, that's available, and they are the things that we need to support and rapidly scale.
Okay, I think we've gotten both your thoughts on the subject of the private hospital and all of that. Let's take a quick look on the new cases that we've had so far. Nigeria recorded the highest daily number since the outbreak of COVID-19 in February, 86 cases, with Lagos having the chunk of it all. Does this mean the lockdown is not working? Let me speak to you, Dr. Chima.
So just to remind us that those numbers are not today's figures. They are figures, reported completed, but they are people who got infected some days back, if you put it that way. So there are more people as at today. So what to think about now is that there's been the lockdown. But we know the challenges, and that is really where we have issues to deal with, especially the challenge of hunger. Hunger is the bigger fighter at this point. And we know there are gaps, huge, significant gaps in it. That's where we really need a lot of work to be done. So lockdown does a number of things. Lockdown slows the process. Lockdown doesn't take it away. Lockdown really slows the process so that the health system can absorb. Because if one person comes today and spreads it to 1,000 people in a gathering, you may have 1,000 people, if everybody catches it, 1,000 people in 2 weeks, so to say. You would have accumulated 1,000 people. The health system can't handle that. If you have a lockdown, it spreads people, and so that rather than transmitting to that size, it trickles down, you know, one after the other. And then if the virus hasn't, you know, somebody is with it, that somebody who is exposed, if it doesn't transmit it, after a few days, that virus dies off. So that's the purpose of the lockdown.
Okay, Doctor.
So that it spreads it. And so it's having a positive impact. Okay. But how long it lasts is a problem, because hunger is biting citizens.
Hunger is biting citizens.
Sure.
Yes, that is an issue with the lockdown. Yes. So what would you say to suggestions that there should be stricter measures to implement the lockdown? Since it seems, I mean, if it's really working, it's been over 2 weeks. Yet, on a daily basis, we have people being confirmed as positive for COVID-19.
Speaking of the lockdown, and okay, first of all, the increased number could be explained away by our increased testing capacity. We remember a few days ago, the Lagos State government said they have started house-to-house testing. So all of this could also have contributed to the numbers we saw yesterday. We are not under the illusion that these numbers will suddenly go away. As long as we continue to test more persons, the chances that we'll have to get more numbers will be there. Speaking of the lockdown, unfortunately, hunger, as you pointed out, is even a more dreaded virus. So somehow we'll find a way to find a balance between these palliatives and also cushioning the spread of this virus.
All right, Raymond, thank you very much for your thoughts so far. And Dr. Chima, any final thoughts before we wrap things up for this segment?
Yes, it's a call really to everybody, to a certain, you know, something that is critical. In moments like this, let's remember that the doctors and nurses, pharmacists, laboratory scientists, healthcare support staff, drivers are in the front line. Their families are at risk. Everybody who has a responsibility anybody that has anything to do to support them should do so. Call their families, call their loved ones, encourage them, send a text message. And organizations like our, regulatory bodies, the Medical and Dental Council of Nigeria, the one for the nurses and all that. You know, while it is important to tell the health workers the rules and the regulations now, they need to step further, to go further than that. All right. To do the kind of things that will make the health workers to value them the more, by helping speak to the government and talk about the importance of making provision for the things that these people need to protect themselves.
Thank you very much,
I want
Doctor.
To look at that. Yeah.
Thank you so much for your time on the program.
Thank you very much.
All right, we'll take a quick break, and when we return, the name of Abba Kyari might still wield power even if he has passed on. This is up for discussion after the break. We'll be right back.